Hello everyone, I'm Dr. RMD, second year pediatric resident at Dr. RML Hospital, New Delhi. Today we'll be discussing about NEET PG preponement strategy, and this is the fourth video in the NEET PG guidance series that I have released so far. This was the most demanded video, so according to the last survey that I had conducted, so most of the people, out of around 836 votes that I got, in that the most voted was NEET PG preponed strategy. Hence I'm going ahead with this. Upcoming videos will be related to INICET discussion also, but today we'll be discussing NEET PG preponed series. So the title that I have given is the battle against time, because time is limited now and January 23 is the date of exam. So I won't be discussing anything related to motivation here. Disclaimer is that this is not a motivational video. This is purely a strategical video based on previous year questions, previous year happenings, and what are the things to be discussed overall. This video is based on that and not on any motivation. So don't think that I'll be giving you motivation that stop crying, that NEET PG is preponed and all this shit. Nothing, no bullshit will be discussed here, just purely strategies. Okay. So if you haven't watched my previous video, then I strongly suggest you go back and watch my previous video, because this video is like the part 2 of my previous video. Okay. So in my previous video, I had discussed how the top 10 subjects, the 10 game changing subjects, they are P4, S4, BF. Okay. Pediatrics, P4 stands for pediatrics, psychiatry, pharmac, and patho. S4 is the 3 surgical branches, that is surgery, OBG, and ortho, and one more S stands for skin, and then BF is biochem and forensic. In my previous video, we saw that how these 10 subjects are the game changers, because these are the highest weightage subjects. The maximum output given that will be given in the limited duration of time, that is for these 10 subjects. Okay, so if you haven't watched, then I strongly recommend go and watch, or else you won't be understanding anything whatever I'm going to discuss in this video. So these were the subjects which we discussed, and this was the subject combinations we discussed, like how you have to proceed in your preparation. So we had given total 70 days for preparation. That there I had discussed the 70, 30, 10 rule. Okay, so 70 days for this preparation, and had given 8 days for this. Okay, and I had given 7 days for this. Okay, so now time has changed. See, whenever NEET is preponed or any exam is preponed, time is limited. When time is limited, you have to increase your weightage, you have to increase your efficiency. So to increase efficiency in a limited given amount of time, time will however decrease, but then you have to make some strategical changes in your preparation. So instead of giving 8 days, I have given 7 days for these subjects. Okay, 7 days each. So this is 7 into 5, because this will go in sets, speeds and biochemistry in one set, 1 week. So you will get 35 days for these subjects, and for these subjects you'll get 5 days each. So total will be 20 days. In my previous video, I had left micro in this, so now I have added micro along with anatomy, and anesthesia and radio I have clubbed together, because you know it is a least weightage subject. Okay. Okay. Now, how will you divide the whole total days? Total I calculated there are 87 days from today. Okay, so today is March 26. Okay, here we have March 31, here we have June 23. Okay, so you know that 1 week is always reserved for the second revision, so I reserved 1 week here. Okay, so 1 week for the reservation, so here you are somewhere around June 15th. Okay, earlier I had given this 70, 30 and 10 for, that is 10 days for the second revision, 30 days for the first revision, 70 days for the fresh preparation. But here from 30 days I have come down to 25 days. Okay, so this 25 days is for first revision. There is no other possible change to make, like you have to limit time, there is no other option. Okay, so when you do this, will come around May 20 here. Okay, so from here to here total you have 55 days for preparation. So you have 55 days for fresh preparation, 25 days for your first revision, and 1 week for your second revision. So how to divide this 55 days? I told you here, 35 days will be given to the 10 game changing subjects, and the 20 days will be given to the rest of the low weightage subjects. Okay, so this is 7 days for this combination. Okay, 7, 5 and 3 is 3 weeks, almost 25 days, which is almost equal to 3 weeks. That will give for first revision, and then you will get 1 week for the final revision. So 7 days each for this subject combination for the 10 game changing subjects, 5 days for the less low weighted subjects, okay, for that combination. 3 weeks for the first revision and 1 week for the last final revision. So this is strategy number 1, how you divide the timeline. Okay, so now you're sure, no more crying, no more shouting that NBMS has or NMC has preponed the date, now you don't have time and all. So I have consolidated this according to this timeline. Okay, so this will be your timeline from henceforth. So stop whining, stop crying, and start your preparation now itself. So second, what are the sources that you have to go through? This is very important. Okay, so when people, in my last video, the basic thing was I had discussed like how many previous questions were asked and what is a recent trend in NEET, old NEET versus new NEET, but I had not discussed what you should read for this NEET, okay, to complete within 7 or 8 days. How can you complete pediatrics plus biochemistry? So when I went through these sources, I got many sources, okay, from my students itself, from my juniors. I got many sources. Okay, the first one was the revision videos. Even in my previous video I had stressed so much on revision videos. Okay, then second was previous year question, which you definitely have to go through. Then pearls, treasures, or DVT or BTR, all that comes in this. I mean, these are pearls, this DVT, BTR, and treasure. These are all the things which give you concise, quick. These are called as quick charts, okay, quick knowledge. You just go through them, you can finish it in 1 minute, and then you have this high yield knowledge in your head. Okay, but these are the disadvantages, that these are very much memory based, so you will forget it easily. Okay, then comes QBank, whether you should go through QBank or not. Then the main videos and notes, then MCQ discussion videos. See, every app has this MCQ discussion videos, okay, where they'll be discussing tough MCQs. Okay, so you have to go through this also. I'll show you how we will go through all this. Then comes recent updates, okay, especially for the clinical subjects, and then YouTube videos. I'll tell you what YouTube videos also. Okay, the main thing is the battle is against time. So time is a limiting factor. So I went through all subjects and what is actually needed from each subject, and I got this graph. Okay, I urge you to take a screenshot of this so that this will be the basis of your preparation. So how do you finish each subject in a given limited amount of time, so that you also give equal importance to all the topics in that subject? Okay, that is, how do you make yourself more efficient in a given amount of time? You have to follow this table. Okay, so this table contains subject wise distribution of sources. Okay, which source you have to use in which way. For example, see here, for pediatrics revision videos you have to watch. Okay, main videos you have to watch. See, whatever is in green is must. Okay, whatever is in yellow is, if you feel that you need to look at that, then you can, but you have to look only through those specific points only. Like in pediatrics, I'll say in my upcoming in the later part of this video, how you have to go through only specific things in pediatric videos and nothing more. Okay, so this yellow is for specific things only. Then previous year questions is a must. Pearls or treasures or DVT, whatever it is a must. QBank is not needed in pediatrics. You will see here. Okay, everything has a logical explanation. This graph took me a few days to make it. I had put a lot of effort in this because I had to go through each and every content to come to this conclusion. So this is not just based on my experience. This is based on the highest efficiency that you can get by using these sources. MCQ discussion is a must. Recent updates is a must in peds. YouTube sources, however, are not reliable for pediatrics. So with these information, you will get highest amount of output. Okay, so biochemistry, again I have put this triple star mark. That is because in biochemistry, especially this flow chart, this pathways, these diagrams, they will actually not make sense if you just watch revision videos. You have to go through main videos. So this specific thing in biochemistry is that you have to go through these pathways and these molecules at the molecular level to understand these things. So then main video or notes becomes very important in biochemistry. But then you don't have enough time also in biochemistry to go through all these main videos, because there will be some 90-100 videos and then you have only 3-4 days to complete biochemistry, which is not possible. So then you have to selectively go through those, and I will be discussing that in the later part of the video. Then previous year questions, pearls, treasures, all this is must. QBank, biochem, I have put triple star because there are these questions especially on the pathways. Okay, because I'll say you in the upcoming part of the video how this number of questions have increased over the past few years. So these can be only found in QBank, and the more you solve these questions, the better you will be at this answering these questions. Okay, then MCQ discussion. Recent updates, however, biochemistry has no recent updates, so you don't have to bother about it, and you don't have to go through any YouTube videos also. Whatever coaching apps are providing you, that is more than enough. So similar is the trend for every other subjects also. See, for example, psychiatry, I have marked this 5 chapters. That is because these 5 chapters in psychiatry will carry the most important questions. 90% of the questions will be from these 5 chapters only. Also, I have, see, this is a very strange trend. I have not told to follow revision videos for forensic, because forensic you shouldn't follow revision videos. You should go to main videos, because in my last video I had discussed how forensic number of questions are increasing year by year. So if you go through the revision videos, then you won't be able to get all those 8 or 10 questions right in forensic. That is where main videos come into picture, and main videos you have to go according to a particular order which I'll be discussing. And similarly for ENT and ophthalmology, you have to watch main videos only the anatomical part, because it is 3D 3D representation, which will be difficult to learn from revision videos only. So if you go to main videos, it will be better. Also for QBank, I have only set selective QBank discussion for topics like pharmacology, where general pharmacology, where you have problem based questions, where and also PSM, where there are problem based questions. These problem based questions can't be learned from your theory. You have to go and solve MCQs. Okay, and as well as recent updates for the clinical subjects, mainly like medicine and PSM, surgery, OBG, pharma, and then YouTube videos, especially for anatomy. Anatomy I already told in my INICET strategy video how you have to go through YouTube for anatomy videos. You can go back to that video and you can check it, as well as recall videos for surgery and OBG. They are very important. So this one this one table actually summarizes everything that you need to study. So the next question is how to proceed ahead with this. Is it possible? Is it feasible? For example, in biochemistry, you have to do all these things. Is it possible? So that we'll be discussing. Okay. So how will you prioritize each of the source? Okay, this is the next question. Say if you are given to finish a subject in 3 days, you can't study everything. So you have to study the things, the source from which 90% of the questions will be asked. Got my point? The aim is not to study everything. The aim is to study the maximum things, because now time is limiting factor. So first you have to always go through previous year questions. Okay, previous year questions and previous year topics are very important. And when you go through previous year questions, initially go through 2018 to 2021. Okay, these 4 years of question paper, so that you get an idea. Okay, so whenever you solve previous year questions, you should go through the questions. It is not meant to solve get correct answers. It is meant to familiarize yourself that which questions will be asked. Okay, so these 4 years, and then I'll say what to do with the 2022 and 23 papers. Okay, then you have to go to revision videos, so that now you know which questions will be asked. Next you have to increase your knowledge about these questions, and also you should be able to answer other questions which will be asked. Okay, so there comes the concept of revision videos or YouTube videos, or the notes. If you have revised, you have to take care that if you have revised your notes, then only you have to go through your notes again. If you have done only one time of your notes and then you are going now again, then it's a foolish thing, because it will take some 7-8 days to complete just notes itself. If you are confident that you can finish the notes within 1 or 2 days, then only go through the notes, or else don't go through the revision videos, because any app revision videos will take less than 10 hours only. It will be 10 to 15 hours maximum, and that can be completed within 1.5 day. Right now it's not the time to battle against time. Okay, so battle with time. Okay, you don't have time. Time is a limiting factor. Third is MCQ discussion. See, there are many subjects where you need the help of your teachers or your faculty to solve MCQs. So without watching those videos, you can't solve MCQs. So MCQ discussion carries a main role here. Then comes pressures, pearls, pressures, DVT or BT or whatever it is, and recent updates. So these will add on to your knowledge, existing knowledge. So you have basic 5 out. If 10 questions are asked from a subject, you have basic 5 questions from this revision videos and PYQs. Then 1 or 2 recent updates or BTR questions or pearls questions will be asked. And then last, if you get time, and if you think that you still feel that you're not enough, you don't have enough knowledge in these subjects, like you need to upgrade yourself a bit, then you have to go through selected topics from the notes and main videos of that subject. Got my point? After this, you have to solve at last PYQs of 2022 to 23, these 2 years. Got my point? This is how you should prioritize your source. Suppose in the 4 days that you got for biochemistry, for example, you are not going to complete everything. Suppose you came till here, okay, till pearls you came. You can't go through main videos and you can't go to POC question. That is fine, because by this time when you have come here, okay, till the time you have come here, within 4 days you would have almost completed 70%, which is more than enough. More than enough to get you a decent rank. Again, I'm repeating, this video is not for toppers. Toppers should study everything. But for those people who think you need a decent rank to get a decent college, or you want to get a branch of your choice, which I have explained in my first video. My first video on why you should attempt NEET PG 2024 explains this thing. Okay, so if you want to get such a dream rank, such a decent rank, or you want to upgrade yourself in the coming months, or you are very much tired of this hearing about this preponement and all, and you want to get a good rank, then you have to follow this strategy. Okay, blindly going through main videos or PYQs is not going to help you. Follow this strategy. This pathway will help you properly. Next, very important thing is subscribe, because I have released 4 videos and I found that 88% percent of the people who watch my videos haven't subscribed to my videos. So if you're not subscribing, you are at loss, because before this I had released these 3 videos which are very much strategically oriented. This is not me boasting about my videos, but the chat box. You go through the chat box of my previous videos and see, no one has released a statistical video on NEET PG so far. That is a comments that I got. Okay, so if you're not subscribing, then you're going to lose. I have nothing to do in that. Okay. Next, coming to subject-wise analysis of previous year question. This was the most demanded topic in my chat box. Everyone has commented, please do subject-wise analysis of previous year questions for NEET PG. So I have come up with this. Say, I could do only for 2 subjects. It is not because I couldn't do for the other subjects. I have done for other subjects. But this video can't go for more than like 2-3 hours. Okay, I can do it for around half an hour. So in this half an hour, I was able to complete only 2 subjects, because there is so much to tell. I have so much to tell you. I have so much strategies, and I have to discuss them in depth also. And I have limited time also. In between my hectic residency, I am taking this time and doing this. So today I'll be discussing 2 first subjects. According to our timetable, pediatrics and biochemistry are the 2 subjects which need to be completed first in this 1 week. So as the week progresses, I'll come up with the other subjects also. So today we'll be discussing pediatrics and biochemistry, and I'll be giving a general outlook on how you should approach other subjects also. So this was the previous year question analysis for pediatrics. See, this is NEET 18 to 2023. So what I found. See, whenever you're going to read pediatrics, what will be there in your head? You'll be going from neonatology, then you'll be going to general pediatrics, then you'll be going to systemic pediatrics, then you'll be going last, the thing which is there, vitamins and minerals concept. I think no one touches that. Okay, or infections, no one touches that. Okay, so what I realized when I put this, the highest number of questions, okay, the highest number of questions were from systemic pediatrics, no doubt. 35 questions have been asked so far, but when you break it down, systemic pediatrics is such a big thing, okay? It will take much of your time. It will take more than 60% of your time, but only 35 questions were asked, okay? Total it is 79 questions, okay? 79 questions were asked totally, and out of that, 35 questions were from systemic pediatrics. But this systemic pediatrics is also covered in pathology, it is also covered in medicine, okay, it is also covered in pharmacology, it is also covered in micro, okay, so everywhere it is covered. But there are few topics which are covered only in pediatrics, and this is mainly, the first part is infections. See, infections, 19 questions out of 79, that is almost 25 questions, 25%. So in your upcoming NEET, if out of 10 questions, approximately 3 to 4 questions will only be from infections. So if you haven't started your pediatrics with infection chapter, then you are making a big mistake. Even though you are very thorough with infection, even though you are very good at micro, there are infections very specific to pediatric age group, and you can't miss to afford any questions from infections. So infections carries the number one place in your NEET PG preparation for pediatrics. Secondly, general pediatrics part. See, in general pediatrics part, what I observed is, when I analyzed the previous year questions, 3 topics form the main point. Okay, one is growth and development. Many questions have been asked on length, height, short stature, and the developmental milestone. Every year 1 question will be there. Second is nutrition. SAM questions many times they have been asked. Third is genetics, this pedigree, which are the autosomal recessive diseases, autosomal dominant diseases, what is the pattern of inheritance. These 3 topics form 14% of the total questions, which are 14 questions were asked from general pediatrics, these 3 topics alone. Got my point? This is excluding vaccination. Vaccination will be discussing in PSM. And then comes systemic pediatrics. Systemic pediatrics, you see, highest number of questions have been asked from CNS. So if in systemic pediatrics you are starting from respiratory system, you are doing a biggest mistake. You are a foolish person, because respiratory system only 2 questions have been asked. So first is CNS, then comes GIT, then comes rheumat, hemat, onco, then CVS, and again in CVS, whatever this 2, 3, 1 questions which have come, all have been on one topic only, that is TOF, tetralogy of Fallot. Repeat questions have been asked on tetralogy of Fallot. So you are studying everything, you are leaving tetralogy of Fallot, you are a foolish person. Got my point? So old NEET and new NEET, what is the difference that you're seeing? See, mainly is with respect to neonatology. In old NEET, you are seeing that many questions were asked from neonatology, but again in new NEET, only 3 questions have been asked. So now will be, if you compare my previous video where I had discussed how many number of questions were asked from previous NEET questions, you will see that this table doesn't correlate with that table. That is because this table mainly deals with deals with the topics from where you have to study so that you can answer those questions. Okay, for example, if a question was asked in 2022 NEET, I think in 2022 NEET based on congenital hypertrophic pyloric stenosis. So this topic covers 2 parts, that is, one is from GIT and one more is from general pediatrics, because acid-based disorders I have included in general pediatrics. So this, then question is one only, but topics that you study is 2. So here it is included in GIT also and it is included in general pediatrics also. So this exactly doesn't correlate, but this graph tells you if you study this system, how many questions you can answer. Got my point? If you study this system, these many questions you can answer. So if you study infection, 19 questions out of 79, that is almost 25% of the questions you can answer in your NEET. Got my point? So we'll see the summary. So summary is always start with infections. Infections holds a number 1 role. Okay, number one topic is infection. Then general pediatrics, growth, development, nutrition, and genetics. Then neonatology, give little less importance. Okay, systemic pediatrics, again start with CNS, GIT, CVS, hematoma. Even if you don't study RS, it is fine because only 1 or 2 questions, one cystic fibrosis, one bronchiolitis, 1 or 2 questions are asked in this. Nothing else is asked. And again, endocrine also only this congenital adrenal hyperplasia, that is the main question that is asked. Other than that, one congenital hypothyroidism asked. Other than that, nothing is asked. Okay. So this is the strategy for pediatrics. Got my point? Now, when you go for this pressures or pearls or treasures, treasures or pearls or DVT or whatever BTR, I don't know, many new fancy names have come. Okay, so all these things which are short memory based. Okay, everything is memory based. So here there are three pearls that you should never forget. 3 pearls, star market today: developmental milestones, pedigree, and enzyme replacement therapy for these diseases. These 3 are the high yielding pearls. This should never be, and rest of the things it should be there. You should revise it before every GT, but these are not that important, but these 3 are very important. The rest of them, 1 or 2 questions might have been asked in it, but these 3 are always repeating ones. So I'm concising with everything. Okay, everything whatever is needed to study pediatrics in 3 days. Revision video from pediatrics is around 10 to 11 hours. In any app you take, it will be around 8 to 12 hours, not more than that. So that can be completed in 1 day. Then pearls can be completed within 2 or 3 hours. I'm not giving, I have summarized everything and given you. It won't even take 2 hours. It will take around 1 hour. And you have to solve these questions also which are there in pearls. Okay. And then say pediatrics revision videos. Okay, main videos, if you feel that in infection you are lagging behind, or in developmental milestones you are lagging behind, go and watch that video, specific video only. Previous year question will hardly take you half day. Pearls and treasures I have already discussed. Q bank you shouldn't learn in pediatrics. Okay, MCQ discussion series videos will be can be completed within like 2 or 3 hours. It is not much. Okay, maximum 3 or 4 hours. Then recent updates, maybe 1 video, or whatever you go through the pearls or somewhere recent updates, it will take you hardly 1 hour. Okay, this is how you finish pediatrics in 3 days. So coming to biochemistry. So how biochemistry, this is very interesting because everyone thinks biochemistry is so difficult, but when I went to previous year questions, it was actually difficult, but then you have to study less for biochemistry, nothing much to study. Okay, if you go without following my strategy, you will have a lot to study, but then if you go actually according to my strategy, you have very less to study. See this, in NEET from 18 to 23, okay, maximum questions were asked from vitamins. Maximum questions were asked from vitamins. Okay, 29 questions, vitamins and porphyrin. I was so shocked. Even in 2023, you see 9 questions were asked from vitamins, and these questions are not like easy, straightforward questions. These are clinical questions. Okay, you should, unless you know the things, you can't answer them. Okay, this is not like some NCERT stuff which you study and you get it right. Okay. The second highest was this carbohydrates. Okay, and you'll also see that in new NEET, higher number of questions are asked from carbohydrates. Proteins and enzymes, earlier more questions were asked, but nowadays questions have become less. Okay, lipids it's almost the same, and genetics number of questions are increasing. Again, I'll tell you, this old NEET and new NEET, I have for the comparison of for the purpose of uniform comparison. Okay, for uniform comparison, I have calculated, I have added all these, and I have converted this 300 marks, 300 questions into 200 questions. Okay, that is how I got 3. Now you will be thinking like 1 plus 2 plus 2 is like 5. Then why did I write it as 3? That is because as I discussed in my previous video, when I uniformly compare new NEET and old NEET pattern, this will be around 3 questions. Okay, so this is one important thing. So what are the take home point from biochemistry, this previous year question, this section, that vitamins is the king. Vitamins and porphyria. Vitamins and porphyria, small subject to study, less time to study, but it carries the highest weightage even today. See, last NEET 9 questions were asked, 9 questions. Then how should you study rest of the biochemistry? First go to carbohydrates. First is always carbohydrates, then go to lipids, then go to proteins plus enzymes. Okay, enzymes again it will be covered partly in pharmacology also, so you don't have to go in depth in biochemistry. Then last go to genetics. Genetics is equally important. Okay, then very important, clinicals. Clinical questions are very much upcoming. When I saw the pattern of questions now in 18 and 23, when I compared, more questions were asked on glycogen storage disorders, mucopolysaccharides, urea cycle defect, porphyria, amino acid, that is tyrosine, homocysteine, serotonin, and DNA enzymes and recombinant DNA technology, that is DNA polymerase enzymes, rDNA, and this splice exons, introns. These questions are increasing because more research is done into these topics. So what is the take home message from this? Take home message is that these clinical things, okay, these things which these, especially these glycogen storage disorders, mucopolysaccharides, porphyrias, amino acid, especially tyrosine, homocysteine, watch from your main videos. Watch from your main videos, because these topics are the ones which you shouldn't mess with. If you mess with these topics, you are going to lose. Your concept should be very strong in these topics. Okay, when I said biochemistry, I'll say in the later part of this video also why biochemistry should be given more important, because it is difficult to understand and you can expect many questions also. In my previous video also I told you how biochemistry, there is an increasing trend. Okay, in last NEET, anatomy plus physiology combined had less questions compared to biochemistry. Biochemistry had 15 questions, so you shouldn't mess with biochemistry. Okay, so what are the pressures or pearls or treasures in biochemistry? Say this: glycogen storage disorders, enzyme replacement theory, mucopolysaccharidosis, and lysosomal storage disorders. Enzyme defects, there is one pearl or treasure specific to enzyme defects only, learn that. Urea cycle is another very important. Electron transport chain, ETC, it's very important topic. Porphyrias again. So these 6 pearls will form around 50% of your questions. 50%, anyhow these pearls will be related to them. So today only star bookmark this. Okay, then coming to less important topics, see there were some 50 or 60 pearls, treasures, DVT, whatever it is, there were 50 or 60 points. I have taken the most important ones only, okay, so that you in this limited time you get maximum output. Got my point? So the next question is, how do you proceed? See, pediatrics, I told you, revision videos. First go through previous year questions, then go through this revision videos. Revision videos will take you around 7 to 8 hours in pediatrics, not more than that. Then you go through this main videos or notes where you feel that you're not confident enough. Okay, previous year questions you have to discuss anyways. Pearls, treasures, or DVTs you have to see. Don't look at question bank in pediatrics because it is not going to help you. Okay, MCQ discussion you have to watch, and recent updates you have to watch. So this is concise pediatrics. Okay, for biochemistry again, revision videos you have to watch, and whatever you don't understand in your revision videos, go to main videos and watch it. Biochemistry is not the subject to mess with. If you don't understand concept, go and make that concept to understand. You give one day extra, it's fine, but you don't mess with biochemistry. Previous year questions you have to do. Pearls, treasures, especially those 6 pearls which I showed you, that you have to do. Q bank, especially for the topics which you feel you are difficult. Okay, whichever I'll tell you in the next video, next slide, what to do with that. Okay, MCQ discussion you have to watch, because just reading from theory won't help you in your MCQ solving. Okay, recent updates you don't have in biochemistry, YouTube video also you don't have to go and watch. Okay, now how to start? Pediatrics, you 3 days. 3 days for pediatrics, 4 days for biochemistry. Go to previous year questions from 2018 to 2021, then go to the revision videos, watch revision videos, then go to MCQ discussions. Then after you have finished with MCQ discussion, now it is time to upgrade yourself. So go to Pearls, DVT, BTR, whatever it is. Then whatever topic you feel you don't know, you are less thorough in, your concepts are not clear, go through those specific topics only from main videos or notes, and then go through the previous year questions of 2022-23 and compare yourself. So can you finish in 3 days? This is the main question. So let's see. For PYQs for 4 years, it will take half day, maximum half day. You have to just go through the questions that are asked and broadly the explanation, bookmark those pearls, okay? Then revision videos. Revision videos is around 7 to 8 hours. It will take around 1 day. Let's take that. It will take 1 day for that. MCQ discussion, take half day. First DVT again 3 or 4 hours. That's all. Then main videos you take half day. And again previous year topics of 22-23 take some 3 to 4 hours. So combine all this, it will be around 3 days. And I bet you will be having extra time left. Okay. So you can finish this in 3 days. Next, how to finish biochem in 4 days? Again, same thing. Previous year questions from 2018 to 2021. Then go to the revision videos and then watch main video if you don't understand. Okay. Revision videos will take around 10 to 12 hours for biochemistry. In any app, it will take almost the same only. MCQ discussion, because you have to be thorough with your concepts and you have to know how to solve MCQs. Then go to these pearls which are very important, so DVT or treasure which are very important. Then go to the main video again if you don't understand any concept or your notes, and then go to the Q bank and then solve this custom based modules. Okay, custom based with the tags of problems, images, pathway, clinicals or recent NEET. Solve these questions if you have extra time, because this is going to be the game changer. Okay, the more you dwell your time in biochemistry, anyways you know that in the upcoming NEET also many questions will be asked from biochemistry. It's not like you're studying all this for 4-5 days and then you will get only one question from biochem. No, I said you in my previous video also, based on weightage, biochemistry carries the highest weightage. Last year 15 questions were asked, 15 out of 200 questions were from biochem. So if you give ample amount of time in this proper manner, then you will be going to benefit from this. That's why I'm stressing more on this. Okay, that's why I selected this first 35 days for this 10 game changing subjects, because these are the actual game changers, and you should know how these subjects will change the game if you utilize them properly. Okay. So the next question comes, how do you manage time? So yeah, right now everyone is might have completed their internship, so everyone has got 24 hours. Say, I'm not the person who studied for like 10-12 hours. That was not my cup of tea. And during my preparation also, I hardly used to study 5 to 6 hours. But because of my smart work, I was able to crack NEET in first attempt. So early morning, 6 o'clock, waking up at 6 o'clock is fine for everyone. Wake up at 6 o'clock. 6:30 to 8 o'clock is a high yielding period. Okay, that time you have to analyze your PYQs. Okay, then morning 9 a.m. to 12:30, take a breakfast break for around 1 hour. Then start at 9 to 12:30, you will get 3.5 hours. Watch revision videos or notes. Okay, then have lunch, and then afternoon 1:30 to 2:30 for 1 hour do MCQ discussion videos. Okay, or you can solve MCQs. Then in the evening between 4 p.m. to 7 p.m, like after 2:30 you take a nap. Wake up at 3:30 or 3:45, have tea. Then at 4 p.m. to 7 p.m. for 3 hours, again watch the theory part, revision videos or recent updates, and then have dinner break for 1.5 hours. Then sit at 8:30 to 10:30 for 2 hours to solve Q bank or PYQs. Okay, so this should be your daily graph, daily timetable. So according to this, you'll get total 11 hours. If we take errors into consideration, you'll get at least 10 hours. So 10 hours are more than enough to get a decent rank. Again, this table is not for toppers. Okay, so say my job is to make strategy. Okay, so without strategy, whatever execution you do, that is aimless, because you will land up nowhere. And without execution, whatever the strategy I give to you is useless. So unless this video makes actual changes in you, watching this video is of no sense. Okay, so start today itself. Whatever doubts you have, you can ping me in the comment section. See, I had this plan when I created this video. I had this plan to include all 19 subjects. Okay, the graph that I prepared, this table which I prepared, I wanted to discuss everything with you. But then I realized that there were so many strategies, there were so many new creative ideas coming in my mind, that for each strategy, for each subject, there are some 3-4 strategies. So 19 subjects will take somewhere 50-60 strategies. Okay, and I can't discuss that within, like, even if you give me 4-5 hours also, it will be less. So then I decided to break it up. So the most important ones are the 10 game changing subjects, and to start with pediatrics and biochemistry. So I started with those only. Okay, so I'm very sorry for not including everything, because there is so much to discuss with you. I have so much in my mind. I have so many strategies. I have so many ideas created in my mind. Okay, So as time goes, I'll move ahead with this table only. We'll discuss everything, okay, but I need time for that. So be updated. So if you want such more strategies and to follow up on all these videos on all this subject, then it's better you click on that notification icon, because whenever you click that, whenever I upload the video, you'll get the notification that my video has come. So this is not based on my opinion, okay, this is the opinion in my previous videos chat box, because many people actually commented that they have never seen such videos on YouTube or anywhere, like the such detailed statistical and realistic strategies. Okay, so all the best for your preparation, and my upcoming video will be based on INICET, because INICET is upcoming, so I'll do one previous year question analysis for INICET also, and after that I'll be going ahead with the other subjects of NEET. Okay, and in between I'll be posting one video on how to review GT, because that was also very much asked, and also one video on FMG, because that is mostly in demand. I got many comments again that FMG video should be released. So weekly I'll make it a habit to upload one video each, so that it will benefit you all. Okay, thank you.